like somebody that isn't even there. So, hey, how are you doing today? I'm Dr. Rutherford. I'm Dr. Martin Rutherford. I am a functional medicine practitioner, also a chiropractor since 1979.
Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractor.
Okay, and we are semi-poorly prepared to do a specific topic today because of a lot of things that we've been dealing with around our office this week. We've just had a very busy week. We've had some computer crashes, and the computer crash didn't get taken care of until just very shortly ago. And if you've watched any of our past presentations, you'll be aware. And if you're not aware, you should be aware that a lot of research, especially by Dr. Gates, goes into each one of those presentations, and they're very well thought out, and they're not cavalier, so on and so forth. However, now this gives us, because we're not prepared for a, shall we say, a scientific presentation today on a specific disease condition or entity that we treat. By the way, for those of you who haven't seen us before, we have Dr. Gates is a board-certified functional neurologist, chiropractic neurologist, and together we are able to work with the brain and the nervous system, and we are able to work with the functional medicine paradigm to address causes. And we're going to talk a lot about that, to address the genuine causes of what's causing such things as fibromyalgia, chronic fatigue, peripheral neuropathy, dizziness, vertigo, balance, restless leg syndromes. This is a part of the things that we treat, and frankly, get relatively consistent, successful, long-term results. Okay, and if I seem like I'm on this, like I might get in trouble today, we'll see. But we've been doing this. I was just looking at some of the courses that I was taking back in 2008 and 2009, and we've been in this since before this became a popular paradigm. A lot of folks out there are aware of functional medicine, and so the title of this is alternative. I think it's something alternative medicine. Be aware of the cookbook. Be aware of the cookbook treatments. Yeah. So I hope that more than one person is going to be watching this, because this is such a key. In our model of care, I'm probably going to do most of the talking today. In our model of care, the reason I'm probably going to do most of the talking today is I'm most acutely aware of this. In our model of care, we use the model of functional medicine. It is the new wave, and I will tell you, it is going to become the paradigm for chronic pain if it is done correctly, which is not easy. Okay, and so our paradigm of care consists of truly beware of the person who says, we're going to get to the cause of your problem and it's going to be easy, or we're going to get to the cause of your problem and we're going to do it because you have peripheral neuropathy, and we're going to do electrical stim to your feet and that's going to work. Or you're going to have SIBO, small intestinal bacteria, and we're going to give you this drug and it's going to fix it. Beware of that. This is the key of what we're talking about, because that is not going to happen. It might happen temporarily, or you may have to do one of these procedures for the rest of your life while you're still declining, but declining more slowly. And this is kind of what I'm going to address today, because functional medicine is a phenomenal paradigm for consistently helping people with these serious chronic conditions that have become, what 120 million people in this country are now classified as chronic pain patients. And what's happening is when Dr. Gates and I started in this, it was a largely evolving paradigm.
Oh my gosh, yeah.
For example, in functional neurology, in what you kind of cut your teeth on, unless I'm mistaken, like dizziness, vertigo, balance, and like migraines, things of that nature. How far has that advanced from the understanding of when you started taking it? And you started taking that, what, 2007, 2007? Yeah. And okay, so we're talking 7 years. So a lot more understanding about the brain and the nervous system, how nutrition affects it, how complex it is, how stress affects the physiology of the body, more specifics of it?
Yeah, week by week. I mean, we just did an update on fibromyalgia, I think, again last week. There's just newer and newer stuff, actually, with restless leg syndrome. And the stuff that's coming out right now is just eons ahead or light years ahead of what was going on 6 months ago.
And I started out with what my mentor, particularly in the beginning when I started, I was a Dr. Datis Karazian, if you've never heard of him. And you think you got a thyroid problem, read his book. Okay, don't read anybody else's lay books on it except his. I will say that with full confidence because people come to me, oh, did you read this, the thyroid solution? Yeah, he was the student of Dr. Karazian, so read Dr. Karazian. Okay, Karazian's book was Why Do I Still Have Thyroid Symptoms When My Blood Tests Are Normal? But he was way more than thyroid. For those of you who have now heard about or now utilize the term, oh yeah, my blood tests were normal, but I know that doesn't mean anything. Or I know my blood tests are normal, but I know that their lab markers are not consistent. Right? That he is where that came from. He was the first one who ever talked about gluten. He was the first one who ever talked about gluten in a clinical sense and really pushed the utilization of it for chronic pain and chronic diseases. He was the first one I ever heard talk about Hashimoto's. I thought Hashimoto's was like a multiple choice test question on my board, and I think that was the last time I had heard about it. I have it. And one of the things that, if I seem a little passionate about this, and I'm not a passionate guy in general, but if I have all this stuff, okay, I have the fibromyalgia, I have the chronic fatigue, the peripheral, I went through a lot of this. I talked to my colleagues. I read the articles. I heard the new miracle cure of take alpha-lipoic acid and B12 for your feet, and that didn't work. And so what I'm sensing now is that let me not get diverted yet. So let me go back to, so this paradigm has been evolving over the past, probably frankly over the past 14 or 15 years. It has really picked up speed in the last 5 or 6 years. Functional medicine is now somewhat popular because Dr. Oz has said that he has a functional medicine doctor who is Dr. Weil, and the three of them are using their great talents to do weight loss with Dr. Amen, and they've put together a clinic. Yes, they have.
Is it Dr. Hyman, not Dr. Weil?
Did I say Weil?
Yeah.
Sorry, Dr. Weil, I didn't mean you. Dr. Hyman and Dr. Oz and Dr. Amen, who does neurology, and Dr. Hyman, who does functional medicine, and Dr. Oz, who does nothing, okay, all got together and they put a weight loss clinic called the Daniel Weight Loss Clinic, and they're running people through and people are losing weight. This is what's irritating me, okay? This is a very sophisticated discipline, functional medicine. And what's occurring is, because there's not regulatory boards in there yet or anything of that nature that can tell you you can or cannot practice functional medicine until you have these understandings, people are now starting to say, I practice functional medicine, come to me, I took a class, here's your diet, here's your supplements, and then a person doesn't get better, and then they think that's functional medicine. So we have that problem evolving. But more than that, the mantra out there, since I have been practicing nutritional medicine, which has been off and on, but I practiced nutritional medicine in the early 80s, was we get to the cause of the problem. The medical profession doesn't get to the cause of the problem. They give you drugs. We give you vitamins, and we get to the cause of the problem, okay? Or we give you this diet and these vitamins, and we get to the cause of the problem. And that's not really true. That's not really true, because it's not that simple. It's not as simple as say, I have pneumonia, I have a bad lung problem, give me beta-carotene and my lungs are going to be good. Okay. What we need to do is find out why my lungs keep I'm talking about me now, why my lungs keep perpetuating themselves with an inflammatory process, and what's causing the inflammatory process. And then finding out what's causing the inflammatory process, and frankly, it's usually going to be some sort of a food, or it's going to be stress, or it's going to be both, or it's going to be something screwing up your immune system. You take care of that, which ultimately will not entail you going to your doctor for the rest of your life, and ultimately you have now gotten to the cause of the problem. And so this is kind of where I'm trying to go. I'm a little bit, I don't know if I'm a teeny bit all over the place here right now, but I'm trying. I don't want to take 3 hours. to try to present this.
And I think we need to use some case examples. So my observation when you were starting into this functional medicine discipline, this was like 2009, at that time, much of the training came from supplement companies.
All of it.
All of it. And so every doctor out there, whether they're
all
a
of the
medical
seminars
doctor,
were
osteopath,
sponsored
or
by
chiropractor, and
by-
we go to these seminars, they're sponsored by supplement companies.
Right.
So the supplement company, gives you this educational, review of, okay, this is what you need to see in this lab test, and it can mean that, and so on and so forth, and therefore you need to take X vitamin. The issue becomes, and they say, okay, you get the patient in, and you're going to run this lab test, and send the lab test to us, and we'll tell you what vitamins they need. And so they'll give you a list of vitamins that you will use in each phase. And there's a lot of them. So when we started into this, patients were taking literally 10 supplements at a time every month, which was a lot of supplement cost, a lot of supplements in general, and people reacted to it.
And a lot of them were getting sick.
Right. And when we would talk to the supplement company, they'd say, oh, that's just part of the normal process. You have to get worse before you get better. The reason why we're doing this broadcast today is because there are still a lot of practitioners out there. In fact, the vast majority now who are jumping into this discipline are doing that.
Exactly.
And we wanted to talk about how we've been there and we've come light years away from that.
Well, and when I say we, when he says we, it certainly means us, but the new paradigm of alternative healthcare is going to be functional medicine. And functional medicine is a sophisticated discipline that requires you to have certain understandings. There are 2 functional medicine courses in this country. One's 250 hours, the other one is 350 hours. There's now a master's in functional medicine that is put out by one of our mentors and one of our people that you'll hear us refer to regularly, Dr. Vasquez, up in I think it's up in Western States,
in Portland.
In Portland College, up in Portland. And when you go through all of those hours, you are presented the paradigm of chronic pain in its entirety. And what you start to understand is that the body is one complete entity. And you start to understand that the brain affects the adrenals. And the adrenals ultimately there's just one pathway, affect blood sugar. And the adrenals affect your short-term memory loss, and the adrenals can affect your lung tissue, and the adrenals can put out something called cortisol, which is causing all that, which also can consistently damage your gut. And if the adrenals are doing all of that, then you can't be making female hormones properly because you're utilizing all of the precursors, all the things that make your female hormones. Now I'm just going briefly through one small part of one pathway. If you have a chronic pain problem, and you have that problem, and you have a gut problem, and you have an autoimmune thyroid problem, what is happening today is that's a very sophisticated condition to address. And that is what's creating much of the chronic pain cases that we're seeing. The fibromyalgia case is a very sophisticated case. The peripheral neuropathy cases, in which the nerves are dying in people's hands and feet, can be stimulated back to normal or almost normal, a percentage of the cases temporarily, okay, which is not fixing the cause. But in functional medicine, you're going to be taught to fix the cause. And in functional medicine, there's an interesting paradigm that has also developed for these types of patients, these chronic pain patients who have chronic irritable bowel syndrome, who have chronic peripheral neuropathy, who have chronic fibromyalgia and chronic fatigue and all that. And that is the paradigm of less is more. Less supplementation is more, not more supplementation is better. And so I want to tie that in with what's happening is because functional medicine, now I believe I and another doctor in here, myself and Dr. Ketchering, are the only 2 functional medicine doctors in the state of Nevada that have been sanctioned by our board
as certified functional
medicine doctors, because we have gone through the protocol. All that means is I can advertise myself and nobody else can as a functional. Okay, Dr. Gates can advertise himself as a functional medicine doctor because he's one of only about 300 or 400 board certified functional chiropractic medicine doctors in the country.
Board certified chiropractic
Neurologists in the country.
Actually, in the world.
In the world.
Yeah.
Okay. So these are sophisticated things. Now, in the defense of a lot of people who are in practice, it wasn't easy to get these certifications to figure out how to get to the cause of the problem. But when you get these, it indicates to boards that you know what you're doing, that when somebody comes in with a chronic pain problem, you have the ability to look at the entire picture, the entire box, by taking a history and saying, okay, these are all the things that it can be. And this is probably all the things that it can be. And now we're going to put together a game plan to actually get to the cause of the problem, maybe use some herbs and botanicals to fix some of the things along the way. But in the end, depending on the severity of the case when they come in and how much their tissues and their physiology is broken down, you should be getting the least amount of supplements that need to be taken, that you need to take, and you should be getting proper dietary recommendations based on specific protocols that have figured yours out. And I go on that one forever because all of these. Okay, no, I'm not going to go on that one right now. I'm going to get to that one. And so your maintenance program should look something like that. For you to stay better, you should be able to have a program that, for the most part, you should be able to do on your own. And what we're seeing today is that because there are no regulatory boards, a lot of people, I don't mind people being out there and doing what they're doing, and people out there and saying, okay, you have this, I'm going to give you this supplement at work that didn't. But don't call it functional medicine. Because what happens is you're going to go to a functional medicine doctor, and you're going to be looking for the cause of the program, and you're going to get what was the topic of this whole thing. See, I finally got to it, which you're going to get some sort of a standard care. You're going to get okay, well, let's see, you have a gut problem, take this supplement, now this supplement, now this supplement, now this supplement. Oh, but doc, it's making me sick. Well, take more of it. Or just keep doing it, because you got to get worse before you got to get better. You don't have to get worse before you get better. You might have a couple bad days, but you don't have to get worse before you get better. So there's a lot of people doing bits and pieces out there. You might go to an alternative doctor. They might say they're practicing functional medicine. You might go with a female menstrual problem, and you might be getting different types of supplements that give you some temporary relief from the female symptoms. However, let's go back to the example that I talked about before. If you're stressed out of your mind during the period that's happening, that mechanism, that stress mechanism that I talked about, is going to sabotage any chance you have of those things working. And if you are not drilled the whole paradigm, you're either not going to know that, or you're not going to let the patient know that you don't know that, and you're just going to keep trying supplements and try this and try that. I call it nibbling. If you're in the position where you are nibbling, meaning I'm going to one doctor and they're trying to fix my small intestinal bacterial overgrowth, and I'm going to another doctor and they're trying to fix my leaky gut, and I'm going to another doctor and they're giving me Bragg's apple cider vinegar because they said it's hydrochloric acid. It might be all those, okay? But doing it in that fashion is a recipe disaster, and it's a recipe for failure. And so what happens is the folks who don't go through these instructional training procedures, who don't have an organized paradigm, tend to use what you called cookbooks. Yeah. What you call cookbooks. And Dr. Gates, right now, Dr. Gates does 99% of treatment here. I get this every day, which is probably why I'm talking about it. Because when I first got into this, and listen, I'm just going to say this. This is a self-promotion. I'm able to talk about this with certainty because we see consistently excellent results with what we do. 100% of people cannot be fixed with what we do. That's part of my job. Part of my job is to do the initial interviews and determine is this person's physiology such that it will respond to non-drug therapies. We're not anti-medicine by any stretch of the imagination. We have a couple of osteopathic doctors that we work with closely on some of the cases that we have, because medication may need to go away, or medication may need to be altered, or they may need a thyroid medication, or maybe we'll use some natural antibiotics and they don't work as well as they do for other people. So maybe they get a real antibiotic, and then we clean them up, and then we get on with getting to the cause of the problem. But there's a very sophisticated way of going about this. But there is no cookbook for alternative medicine. And what's happening is people are out there now. Chronic pain is the industry now. Everybody is now figured out there's 120 million chronic pain patients out there. I'm sorry, that's where the money is. Okay, that's where the money is. So let's get into chronic pain. Yeah, I mean, there are people out there just waving crystals over people for chronic pain. I'm sorry, I'm sure that helps for something. I get magnetism and I get all that type of stuff. But they're calling themselves functional doctors because they're saying the crystal changes function. Functional doctor, and so what we're seeing when people come in for me to do these consults and for me to do these screenings to determine whether a patient is a good candidate. One of the reasons we get good results is we determine whether patients are good candidates for what we do. And what I used to get when I first started this was, well, you guys aren't medical doctors, how do you guys know this? And I went to the Mayo Clinic, and how are you going to fix me in the Mayo Clinic? So I had to deal with that, like years ago. All right. Now it's more, we have a more savvy public. We have a more internet savvy public. A lot of people come in and have done their research. And now I'm starting to get, well, I went to the doctor, and I went to Stanford. Was it Stanford where they got the SIBO thing? Oh, no,
Cedars-Sinai.
It's Cedars-Sinai. I went to Cedars-Sinai, and they checked me for small intestinal bacteria, and they gave me the drugs, and it didn't, or it felt good while I was on them, and when I got off of it, it's gone. Well, that's because they didn't get to the cause of the problem. Even Cedars-Sinai is now going, okay, this is a medical model. We got SIBO, we're going to kill it. And then the person's going to get better. No, they're not, because it's part of a larger problem in which the cause is over here. But that's the medical model. Well, a big part of the problem is those folks who want to get in on the chronic pain game and the chronic illness game, but either don't want to spend the time, the effort, the money, they don't want to put the time in to learn the whole paradigm or whatever, are going to be coming out with you with an alternative medical model. You come in, I'm going to give you a diet. It works for a while, it comes back. You come in, I'm going to give you a pill. I'm going to give you a supplement instead of giving you an antibiotic. For those of you who want to know what the natural antibiotic is for small intestinal bacterial overgrowth, it's berberine. We've done a whole segment on it. Okay, we've done, my God, I don't know how many hours we've done online sharing what we know with folks to allow them to understand the complexities of what they're getting into. And our society has a little bit to do with it. We're still a society that is now developed into, we're looking for a quick fix. We're looking for, and we're kind of drilled into a pill. We're kind of drilled into what's the simple way of doing it. We're deceived. For those of you who are watching the internet, I might insult you, but these are all the things that I get in my consultations. You've done your research. The vast majority of people who come in here have done the research, just aren't aware that they don't have the background to be able to evaluate that research in the context of what's going on completely.
Especially when there's doctors out there who are not getting it right or choosing not to get it right. I mean, the strength of our program is that, like we're talking about, we had the cookbook. We saw the fallacies in the cookbook.
And we had to start out with the cookbook because now you went, okay, so I was in this before Dr. Gates was in this. Dr. Gates comes in, and he is a board certified chiropractic neurologist.
There you go.
Okay, yeah. Which means he, like, in my opinion, this is my verbiage, is my opinion, okay? These guys are like the Navy SEALs of the brain and nervous system. They have to understand the function so acutely because they have to use that ability to be able to get your brain to start functioning properly using exercises and using different types of stimulations. And the more acutely you understand the brain, it's like being a brain surgeon without the knife. Yeah, that's my opinion. Okay, that's my opinion. And he wouldn't say that. And maybe even, well, Carrick would probably say that. He's the guy who developed the whole thing, and he's kind of an interesting character. But the bottom line is we have that. Okay,
right.
We have that, and then we have where was I going with that? Then we had the functional medicine. Then we had the functional medicine group. Oh yeah, I know where I'm going. So he came in after me. So he's got all that. Then we had the functional medicine group. So he didn't come in really conversant Well, actually, you guys learned a lot about the nutrients of the brain and all that type of stuff.
And biochemistry was a passion.
And biochemistry was a passion in him. So he had a special knowledge that lent himself to functional medicine. And I was doing the functional medicine, and I was just getting out of the cookbook-ish type of stuff because I was just realizing that it wasn't working as well as it could because I just didn't have the skill at that time. I didn't have the clinical expertise to start seeing this person had this reaction, so we had to go this way and putting it all together. It's like anything else. You get in practice, you learn as you go along. But I took you to a functional medicine intro.
Oh, the one down there in San Francisco.
Which was 3 days.
Right.
And it was put on by a vitamin company. I'm not going to mention the name of the vitamin company, okay? Because they actually make good vitamins. But understand, they're in the business to do what?
Sell vitamins.
To sell vitamins, okay? So we're sitting there listening, and we have to kind of like go, okay, we're doing this. And we're listening to the seminar, and we're going, wow, you know, if we were giving our patients all these supplements, they'd be getting sick, okay? Right. Now, having said that, there was 3 days long, and there was a presentation on everything you could possibly imagine. How to deal with high blood pressure, how to deal with diarrhea, how to deal with female issues, how to deal with andropause, how to deal with pretty much everything. And then they got to the part of the seminar that we would be interested in, which was autoimmune problems. Because for those of you who are not aware, if you have fibromyalgia, chronic fatigue, fibromyalgia, if you have dizziness, vertigo, balance problems, you have trouble losing weight, I'm going to tell you, there is an awfully good chance you have an autoimmune problem that you're not even aware that you have. Okay, how do we know? Because we see it here every day in our world. And so autoimmune problems don't do well with a lot of dosaging. In fact, I mean, when I started realizing it, I started realizing, well, more than 3 or 4 or 5 supplements at once was almost too much for these folks. And when I interview people when they come in on the consults, and they say, and they come up with these 2 bags, they say, how's that doing with the supplements? They're making me sick, man. I'm like, yeah, you're autoimmune. You're not supposed to be taking that many supplements. But anyway, so the bottom line is this: we're at the seminar. They get to this part of the seminar where they talk about autoimmune, and just kind of blew by it.
Yeah.
Now, why would they kind of blow by it? Well, I can only conjecture. It's because they know if they give too many supplements to an autoimmune patient, it's going to make them sick. And it's a vitamin company that's putting it on, and that's putting the seminar on, and they're there to sell vitamins. They're not there to tell you what. Oh, and by the way, the 120 million people that you're trying to attract that have chronic pain and that are not getting better with anything, oh, if you give them like lots of supplements, they're going to get sick. Okay, so I'm trying to draw a picture that if you have these issues, and these are the people that come to us, these are the patients that come to us, there is no cookbook for this. There is no take one supplement. There are multiple systems generally involved in chronic issues. Chronic issues, and that even goes for if you have a chronic low back pain for years. If you have chronic low back pain for years, and you've been the chiropractor and the physical therapist, and you have epidurals, and you've had surgery, and you've had everything, and you still got it, I'm going to tell you, there is something else going on, or you wouldn't have the pain. It might be a brain issue. Believe it or not, you might. Usually, what I find, and I am a chiropractor, okay, and I've been a chiropractor since '79, so I had a primary musculoskeletal practice at one time, and now my practice is 95% functional medicine. And I still treat some people that I've known like since the 1980s. I haven't been able to politely kick them out of my practice because we're like friends, you know. But the bottom line is this: I'm still a chiropractor, and when I started into functional medicine, I started finding that the true cause, now we're back to the true cause of their problems, the true cause of the problems of the patients that I was consistently adjusting and feeling guilty about it, because I would say, I don't feel like I'm really doing much for you. He said, well, I feel better for a couple of days. Those people now, in retrospect, understanding neurology, because I've been hanging around him for 5 years now, and understanding functional medicine, because I am certified in functional medicine. I have taken the courses, I have passed the tests, and I have treated thousands of people. I now can go back and realize those people's back problems was either stress, or it was their cerebellum, which controls all their spinal postural muscles, or they had autoimmune problems, which usually, in retrospect, they had tenderness and they had those types of things. So, and I'm not knocking chiropractors, but because I was one. I was taught that by manipulating spine, I was getting to the cause of the problem. And in many cases, I was. And in many cases, I wasn't. So you have to be careful about when you walk into a doctor and you start to get the feel like I'm getting a silver bullet. Okay, this is it. We're going to take your SIBO. You're going to get better. And you can refer to any of our DVDs, any of our presentations on
PowerHealthTalk.com.
On PowerHealthTalk.com.
Or just type in YouTube Dr. Martin Rutherford or Dr. Randall Gates, and everything comes up.
And you can look at what would one of our gut presentations be?
We have a good one on IBS. We have SIBO. We have IBS.
If you want to understand the sophistication of what we're talking about, go look that up and find out how everybody that comes into our office has a bad intestines. Virtually everybody, whether they have peripheral neuropathy in their feet, whether they have dizziness in their brain, whether they have a direct hit on their gut, whether they have rheumatoid arthritis, everybody, and gut means small intestines, large intestines, liver, pancreas, gallbladder. I forget gallbladder because most of my patients don't have one by the time they get here.
Right, and a lot of people say, well, they're normal. They're normal. Well, what is normal? They're normal enough to where they're not suffering, but in actuality, we have definitive testing that shows their problem is stemming from the gastrointestinal tract. Just like Dr. Carrick. Lots of times a neurological test is normal. The person doesn't completely fall over and hit the ground. But, if they sway and they have to move their feet, well, maybe something's going on there. Maybe it's not as good as it could be.
Right.
And so that's what we're looking at with an acute model. And I think we should use some case examples. Let's talk about peripheral neuropathy. There are people out there treating peripheral neuropathy
using a case example of not buying into
the cookbook.
The cookbook.
So the cookbook out there for peripheral neuropathy is two-sided. Peripheral neuropathy is where people get numbness and tingling in their feet. The nerves are starting to dysfunction or die. And some practitioners out there will say, okay, we have this electrical stimulation unit where we're going to stimulate the nerves back into life and you're going to feel better. It's probably accurate. You're probably going to feel better temporarily. But then as soon as you stop doing it, it's going to come back. And they're going to sell you on, well, you need to come back once a month for the rest of your life to do these maintenance treatments. And then there are people out there using these powerful lasers, which basically bring down inflammation. They may put it on the lower back.
We're going to use both.
They may put it on the feet. Absolutely. And they'll say, well, this laser is going to cure your peripheral neuropathy because Joe went through our program and he did well while he was in our program. We'll talk to Joe once he's out of the program.
Right.
Because as soon as you stop doing it, lots of times these symptoms will come back. Same token, there's the functional medicine side where the functional medicine practitioner slaps his hand on the table and says, you're deficient in alpha-lipoic acid. You need to take 600 milligrams 3 times a day. You got to take B12 because B12 deficiencies cause peripheral neuropathy. And you take those vitamins like you did because you have peripheral neuropathy. You don't feel any better.
Yeah, I do feel
or maybe you feel a little bit better, but it's not all the way gone. The thing is that these are things that monkeys can do. I'm sorry.
Hey, that's me. He's finally getting it. I always say, we're like trained monkeys out there.
Yeah.
Like, okay, you have this, let me give you this. You have this, let me do that. That's cookbook.
That is cookbook.
People are hoping it's going to work because that's much easier than going and taking 350 hours. How many did you take?
Yeah. Oh, gosh.
Yeah.
It's way high. And then the other side of it is that, more importantly, we have spent 5 years running basically research experiments in our practice, figuring out, do these supplements work, yes or no? When we went to that seminar on supplements, they were talking about this product called glutathione recycler. I tell you, I loaded people up on the supplement. I saw no change whatsoever. So guess what? We don't use it. So we've had the opportunity to fine-tune our methods over 5 years to figure out, okay, exactly what works in what situation that's right for that person.
Interruption. If you're taking supplements and you're not seeing an effect, positive or negative, stop taking them.
Right. And I'm sorry for referring to, a monkey can do that, but in essence, it's a cookbook.
No.
It's a shame that you have a doctor out there who 10 to 15 years into learning their craft and they're doing something that brainless. And I think that's what drives
they're not happy. And they're not happy. But what truly today in the medical field, the screws are down. Doctors are getting paid less. They're looking for other streams of income. Well, I'm really going to get in trouble now, but you know what? There's a reality of it. Okay, and so what's happening is everybody's looking. I'm listening to all the local hospitals now, and they're advertising. We're in Reno, So I'm listening to all the local hospitals advertising now. Your best medicine is a puppy. Your best medicine is eating fruits and vegetables. I can remember in 1980 being laughed at by the medical doctors because of telling people that. Because they're losing people's faith. They're losing people's people don't want to go to them. They're losing people's respect. And they finally had to go, wow, tons and tons and tons and tons of people out there are reaching into their pockets to pay their hard-earned dollars to these whack job alternative medicine guys who they think are fixing them. Well, guess what? They are getting fixed because these things are working. And now they finally had to come to the conclusion of, man, maybe we better get in on this because we need to sustain our business. We need to sustain our hospital. Mm-hmm. So we're going to do seminars on that. And then they do seminars that are Cookbook. Right. I'm sorry.
Yeah.
I'm sorry. And this has been bugging me for so long.
So we're basically saying this cookbook model, it can apply to the standard of care, the way that patients are triaged through the medical model, and it's happening in alternative medicine. I know someone, I had a very close relationship with someone who actually did not become a medical doctor after they went through medical school and got their PhD because they said everything is just cookbook. This lab test says this, you give this drug. That was basically the model. Well, the same thing is happening in alternative medicine. What you as a patient out there need to find, whether it's a medical doctor who practices mainstream medicine or an alternative doctor, someone who figures out the right treatment for you, not just the right treatment based on what some guideline says or some supplement company says. These guidelines, well, I'm not going to go into that, but a guideline medically or a supplement company instruction.
So the things to look for, and I could go on for hours on this, okay? So, but you don't really hear all that. The things to look for are this: when you're when you're having to get all right, let's go back to we're going to get to the cause of your problem, okay? Even let's just go back to the alpha lipoic acid and B12. If you're someone who has peripheral neuropathy, you're familiar with what I'm talking about. If you're not, people who have peripheral neuropathy, numbness, tingling, burning in their feet, almost every practitioner knows now to give them B12 or B6 because the vitamin companies have done such a good job of marketing it, and everybody knows that it has something to do with nerves, that they all give it to people. And then if you take something like that and it doesn't work, and if the explanation is you just got to keep taking it, or if you don't keep taking it, it's going to get worse, you probably should start thinking about maybe that's not right. What you want to do is to start to think the way that we think in functional medicine, and here is what we think. We think that when the body is brought into a state of homeostasis, of balance, to where all of its systems are working again, if that's possible, if those systems are not too far gone from being recruited, okay, if they can come back to a sense of balance, and if your cells, those little mitochondria in the cells, can make enough energy to create that response, that person's going to get better, all right? That's our model. And off of that model, when someone comes to us and says, I take alpha lipoic acid and my feet feel much better and I'm going to keep taking that, my response is, okay, why do you need alpha lipoic acid or B vitamins? You can get that. You can get that in your food. Oh, well, I'm not eating it. Oh, so you're either not eating that food, or, and there's just one example, or I have someone who comes in here and says, well, I'm eating 50 different things that have alpha lipoic and B vitamins in it, and I still need to take these. Well, why would that be? The true cause would be something's happening where you're not absorbing it, or you're not breaking it down. Maybe you have an autoimmune problem that's called pernicious anemia that has something called an intrinsic factor that's damaging your B12 and not allowing you to absorb it. Maybe the solution is to calm down your immune system, fix your gut, and have all of those B vitamins that's in your diet get through your gut and into your system, and you don't need to take supplements for the rest of your life. Because whether it's taking supplements for the rest of your life for peripheral neuropathy, or whether it's going in and getting laser and then being told now all you need to do is come in once a month to get laser for the rest of your life, or if it's going in and doing a rebuilder for the rest of your life, this is an electrical device that we use all this stuff. But if it's a electrical device that is you're gonna have to use for the rest of your life, because you're never taking care of the actual problem that caused the peripheral neuropathy in the first place, your peripheral neuropathy ultimately is going to start to get worse. You're going to need to use that machine more. You're going to have to turn it up, and then eventually there's going to be a point where it's not going to work because you really didn't get to the cause of the problem. Now, as long as you understand that, and if you want to do that, and if you want to take that avenue, that's fine. But you should have that explained to you that that there's a reason that your feet are numb and tingling and burning. There's a reason that you came to me and I gave you the drugs, or I gave you the natural antibiotic for small intestinal bacterial overgrowth, or I gave you the herbs for your leaky gut, and you felt good for 3 months, and now it's back, worse than it was before. You need to understand that that's the paradigm that you're being presented, and that's okay as long as you know what you're getting into. But if you think that, but if you're looking for success, you need to understand those are cookbook paradigms, and those are not individualized protocols. And this new underappreciated, becoming appreciated patient population of autoimmune patients, they are a complex group of patients, and they require a complex, specific, individualized workup. A functional medicine doctor or someone who claims that they can take care of these things should be very conversant with every aspect of what can fix that. Mm-hmm. The food allergies, the infections, the nutrients, the mitochondria,
mm-hmm.
the stress involvement, the viral infections, the endocrine stuff, the toxin, all of that. You have to evaluate all of that in a chronic pain patient who comes in the door. All of it now at once. And then, because, as I say in the fibromyalgia tape that we have online, I can have 100 people come in with fibromyalgia, and every one of them is different. Every one of them has a different combination of those multi-factors. They're calling them what? Multi-systems infectious diseases now. The new paradigm is, if you have a multiple system infectious disease that's causing your peripheral neuropathy, good luck on taking alpha-lipoic acid. Okay, which is a cookbook paradigm. All right, if you have chronic inflammation in your lungs, good luck on taking beta-carotene without finding out what's causing the infection, which may be in your gut, which may be parasitic, which may be viral, which may be a food allergy,
an allergic disorder,
and so on and so forth. That's kind of, I don't know if I'm making sense here. But we weren't prepared to do a specific topic today. But this is something I've been seeing growing and growing and growing over the last year. This confusion in the patients of, but I read on the internet, I got the supplement, it didn't work. But I went to this person and they sent me over here to Cedars-Sinai, and I did. We have a couple patients who've been to Cedars-Sinai. Not knocking Cedars-Sinai and not knocking the medical profession. Okay, they have a very good paradigm for acute problems. But it covers over into, okay, they gave them the antibiotics as soon as the person gets off of it. These are complex issues. That is a cookbook resolution in the medical model. And we're just saying that's what you're going to be exposed to most. That seems like that now people are getting bits and pieces of what functional medicine does and what functional neurology does. Another example would be if somebody has dizziness or vertigo and they go to the physical therapist for balance problems, and the physical therapist stands there and has you do this. This is an exercise for what?
For your cerebellum.
And it's not a good exercise for the average person who has a one-sided cerebellar problem.
In our experience, as well as the fact that a lot of the patients that we encounter with dizziness we're finding to have autoimmune attacks where the immune system kills the cerebellum.
But that person, and people ask me these questions all the time.
Right.
Why did my doctor know this? Why doesn't my doctor know those tests? Why didn't this alternative medicine doctor know this? Why did the physical therapist? Well, then why doesn't the physical therapist know that this isn't going to work for me? Because the physical therapist went to one class. That person who was doing that class said, "Oh, I'm going to make money teaching people how to do this. I'm going to go out and show something very simple that nobody has to put any effort into learning. I'm going to tell them that this is what's going to be done. They're going to pay me $695 to sit there for 8 hours, and then they're going to go back to their clinics, and they're going to find out that it doesn't work in a lot of people."
Or that it works marginally. You know, that's the interesting part about this research-based, evidence-based medicine, is that we try to create these studies, and we don't have a lot of information like on that topic that you're talking about. So they did the study where the person does this, and there was improvement in that patient population, but maybe it wasn't to the degree that what we're seeing or what Dr. Carrick has proposed in his treatment models. One thing I want to say for the record, I retract the statement saying that, you know, people are monkeys who run people through those electrical stim treatments and laser treatments. I retract that statement. That's not what I was intending. What I was just intending to say is that this is a complex issue. Just on that basis alone regarding peripheral neuropathy, we're writing a book. We have put a tremendous amount of time into this book. It's painstaking to put out an actual good piece of literature for a person out there with peripheral neuropathy to understand.
It's for the lay public.
And the emphasis of our book is talking about exactly this, the merging of functional medicine, looking at the underlying cause of the peripheral neuropathy, which can be 80 different things, and the merging of functional neurology or a board-certified chiropractic neurologist, where we're going in, we're trying to stimulate the nervous system and retrain the brain into its normal functioning. And it's a complex process. It just is. I know, so that's what I was intending. Again, I retract the statement that, you know, you're a monkey if you just do electrical stimulation completely. But, you know, Dr. Carrick, this is one of his pet peeves as well, because there are a lot of people out there who try to take what he's done and distill it down into something very simple. And really, it's not right.
You can't.
You can't, because you have to fully understand it. It's like going to get your Jaguar worked on by the GM guy, and, you know, it's just a different animal.
If it were easy, there would be 120 million chronic pain patients out there.
Exactly.
And a trained monkey can do it.
Those are your words, not mine. I retracted my
words.
statement. I retracted my statement.
You retracted that statement, but what I have said is we're like trained monkeys when we're doing that. That's what I have said. We're like trained monkeys. What Dr. Gates is referring to is, and this is part of the problem, a lot of times what occurs is, frankly, the paradigm today, if your healthcare is being paid by somebody, like a third party, like an insurance company or the government or something, they are to a large part dictating what your doctor can and can't do. And I will tell you, the doctors hate it. They don't like it. They don't want to do it that way. They don't want to be like trained monkeys. And I've said this to acquaintances of mine who are doctors. Okay, I'm not insulting them. I'm commiserating with them. But the reality is you get a diagnosis of peripheral neuropathy, it's Cookbook. You can, based on your diagnostic code, they can look for diabetes, they can look for a problem in your back, they can look for a problem in your neck. If you are obvious, if it's as a fact that you just had chemotherapy and your feet are numb, then they can look for those. There's one other thing, tarsal tunnel. Mm-hmm. Pretty much that's it. Dr. Gates blew by that pretty quickly, but there are 80 potential causes which are discussed in the book that we're collaborating on for peripheral neuropathy. We didn't make them up. They're all in the literature. They're all in the medical literature. Yet these are only 5 that the paradigm that code wants to pay for. Okay, so you are getting shorted on not being evaluated for all those. And the reason is not that your doctor's stupid or your doctor didn't learn about this stuff. The reason is that this is where it's at. You look at if that doctor starts ordering other tests, doctor starts doing other innovative things, that doctor is going to be reprimanded by those folks. They're going to get a call and they're going to say, "What are you doing?" And we're not paying for that. It's not medically necessary. And you keep doing that. You know, you keep ordering all those tests to try to figure out what's wrong with these people. And next time we decide on who our doctors are going to be in our board next year, you're not going to be one of them. That's not a secret. That's not like something even controversial at this point in time. Like even the patients know that at this point in time. So that's what you're up against. But you're up against so much. But I have no control over that. And I just feel that I just feel that those of us, and there are a lot out there who have put the time in, who are qualified in their field. The reason that I'm irritated about this is now what I'm getting is people coming in and say, the only reason I came in is because I have a friend who saw you guys, and she said you guys we did pretty well, and she's feeling a lot better. But I've already been to one or two doctors who have said they do functional medicine or they did this or that, and it didn't work. In fact, I got worse. And so now that's putting a negative. Opinion on what functional medicine is. Those people don't really know what functional medicine is, and it may very well be the answer to their problems. So I may just be venting, but everything I'm saying is what I'm experiencing in our consult, and it's stopping a lot of people from getting better. A lot of those people who go and get those temporary Cookbook treatments don't come into our office or to anybody's office. They just say, okay, I tried that, it didn't work, now I got to live with it for the rest of my life. And that just, on some level, that seems very wrong. So I mean, criticize these colleagues. I feel bad for people who have had their incomes reduced and whose patient populations are drying up because insurance companies are limiting what they do and they're limiting the patients that will go to them. I feel badly for them. But the reality is they're still human. The patients are still human beings. Patients still need to be. You need to be straight with them. You need to know what kind of a result you're going to get. You need to be kind of like upfront with people and saying, well, here's our results, and it may be temporary, and things of that nature, and not say we're going to get to the cause of the problem and you're going to be better and so on. So in these very, very complex cases that are not going to respond to a cookbook, and if I've hurt my colleagues' feelings out there, then I apologize, but so be it. I apologize, but so be it. But this is about the patient. I was one of those at one time. I went through this. I didn't shade it then. I didn't make a big deal about it because I just kept trying things and I just kept assuming that I had something that couldn't be helped. And that's where a lot of you may be. Okay, I was very, 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 very lucky that I saw a little credit card ad in a magazine one day that said best program in America on fibromyalgia. And the guy turned out to be a board-certified chiropractic neurologist in Appleton named Dr. Johnson. And then ultimately, he hooked me up with another doctor, the doctor I mentioned before, Dr. Crosby. These two guys are for real. They were for real. I got what for real was. I'm much better. But neither one of them promote that this is easy. They promote you're going to have to change the way you do your business. You're going to have to change the way you practice with people. You're going to have to take more time to do a history. You're going to have to do a complete exam. You're going to have to get very with targeted testing. You're going to have to know what your nutrients are. You're going to have to know your pathways. You're going to have to know these things. And I was very excited because they were right. And I can be a testament to their right because I'm much better and our patients are getting better. And I'm just getting afraid now that the paradigm is being diluted and maybe being denigrated by not getting the results out there by people who are promoting themselves as getting to the cause of the factor and doing cookbook remedies and not getting people better, and then it's reflecting on the rest of us, but more so their potential to ultimately get better after being told that they just have to live with it now. So, or them thinking they just have to. So I'm done ranting.
Okay.
And hopefully one person watches this, and if one person watches it, gets it, great. But I've had to get this off my chest. So thank you if you watched this whole thing, thank you for persisting through it. And if you have any questions on any of that, don't call me because it's just going to get me in more trouble. But if you have any questions on maybe the paradigm of functional medicine or maybe anything some questions relative to what you've experienced and maybe where to go from there for your chronic problems, and maybe you've experienced some cookbook stuff and you have some questions on that, and where you go from there. Those questions, we'd be happy to answer if we can at all possibly answer them at powerhealthtalk.com. Mm-hmm. And then you can look us up on Facebook. Is that it?
Yep. Mm-hmm.
And then for those of you who have neuropathy, to see what we're talking about, we have a peripheral neuropathy
group.com. So peripheral neuropathy group.com.
Yeah, so if you're interested in that. But thanks for listening to me rant. I don't know if it made any sense. I don't know if you got anything out of it. I hope you did, but now I'm better. I'll be back to normal. I'll be back to normal next week.
We'll see you next week.
Okay.
Thanks for watching.